Back. We're going to get started. I invite you to join us in the reception after our keynotes tonight, and also to visit our poster sessions that are happening outside the exhibit area in the atrium. The presenters will be there 6 to 7 p.m. to talk about them. I'm pleased to introduce our next keynote speaker, Congressman Andrew Harris. Congressman Harris represents Maryland, is a member of the GOP Doctors Caucus, and will share some perspective around biomedical research and innovation. He'll be joined for Q&A by Jane O'Donnell, the healthcare policy reporter with USA Today. Please join me in welcoming Congressman Harris.
Thank you very much. It's a pleasure to be with you here this afternoon and inviting me to speak to the group. I have a unique perspective, I think, among a lot of the members of Congress, because I'm not only a physician, one of the members of the House Doctors Caucus, but I'm actually on leave from the faculty from Johns Hopkins and have been the only member that has been an investigator at NIH in the course of my career. Earlier on in my career, as I studied neonatal and fetal cerebral blood flow physiology. But what I would like to talk about today, because this is about delivering health care to the world, is what is the future for biomedical engineering and biomedical product development and pharmaceutical development in the world, and how do we maintain, what's the lay of the land, how do we maintain America's prominence in a rapidly changing environment. And again, I'm going to do this from the point of view of someone whose interest is in not only making sure that we develop these cures and get them to patients, but that the United States maintains its leadership role. And look, why should we care about that? Why is this of such critical importance? Because the bottom line is that the cost to the federal government, the cost that we have to bear or we pass on to American taxpayers, is tremendous of health care for some diseases that I think we can cure with the right approach. Everyone in healthcare knows that if you look at the demographics and the costs of taking care of, for instance, patients with Alzheimer's disease, with diabetes, with heart disease, these are, if we don't solve these problems and we don't cure these diseases, they're associated with huge fiscal problems into our future. In fact, fiscal problems that we probably can't solve without solving some of those healthcare problems. In addition, it's a tremendous opportunity for America because we are the leaders of biomedical research in the world. About 40% of every biomedical research dollar is spent in the United States, and with research that occurs in the United States. But it creates a tremendous economic opportunity. As I tell people, hundreds of millions of people around the world in the next 20 to 30 years in the developing global economy, in emerging markets, in second world economies, are going to enter the middle class. And when those hundreds of millions of people around the world enter the middle class, as they are today in China, as they will be in India, as they will be again in emerging nations, one thing that you get in the middle class is you get health care. And you get health care at a level, again, that people will come to expect, and we should be the leaders in developing some of those health care products and delivery systems to those hundreds of millions of people who will enter the middle class. And finally, the reason we ought to do it is because finding cures is just the right thing to do. I mean, our American leadership in the world has always been there on biomedical research, and it's just the right thing to do. Now, one thing that we have to do, we have to realize that as you look at how biomedical research occurs in the United States, it's about a $120 billion sector. About a quarter of it comes to the NIH. Now, we talk a lot about that on Capitol Hill because that's the part we're responsible for. But honestly, we really need a system. We need to develop a system where someone is paying attention to the entire biomedical research field and integrating and coordinating, the basic research that's going to occur at the National Institutes of Health or funded research through the National Institutes of Health, and then seeing to it that those translate into products and processes that actually reach the patient's bedside. So we are clearly the leaders in the world, there's no question about it, with about 40% of the worldwide biomedical research dollars spent here, and certainly getting the NIH to be the basic science research generator in the country, as well as the institute or the institution that makes sure that we train the next generation of researchers. So what do we have to do if we face challenges? And you're going to hear a lot about this in the next few months as the Congress takes up what's called the 21st Century Cures legislation that's coming out of the Energy and Commerce Committee. This legislation is going to be aimed at really modernizing the way we develop new products, new cures, new methods, and then we deliver it to the patients. And a key role in that, I think, is to take the NIH and the approximately $31 billion we spend each year at the NIH and making sure we're delivering it in the best possible way to end up with cures. Because in the end, that's what the NIH is all about. That's what its focus ought to be. And one of the things, I'm only going to talk about a couple of things that are going on at the NIH that we really need to look at modernizing and reforming. The first thing is we have to be certain that we reorient a lot of the NIH emphasis on making sure that we fund young investigators and make sure we develop the next generation of investigators. It's interesting if you look at statistics, and we look at, because again, we want cures, we want breakthroughs, we want eureka moments in the funding that we fund, in the projects that we fund in the NIH. What we ought to be doing is saying, okay, who is most likely to make those discoveries? And the answer is pretty interesting, because if you look at, for instance, at what age people make their breakthrough discoveries, if you just look at a graph, and I urge you all, Google it once, and look at the graph of when people make their Nobel Prize discoveries in medicine and other fields, the answer is they make them in their mid-30s. They don't make them in their 40s. They don't make them in their 50s. It's not senior investigators that are winning Nobel Prizes. It's people in their 30s. And I would say that if you ask your children or grandchildren when people are most likely to make innovations, they'll probably say even younger. You know, it's no accident that Bill Gates was 21 when he invented the operating system that changed the way the world works. Or Steve Wozniak, 26, when the patents were issued for the Mac computers. Again, changed the way the world thought about things. Mark Zuckerberg, 20 years old, developing Facebook, a billionaire by age 23, basically making groundbreaking discoveries in their fields. Ladies and gentlemen, I think it's the same in the biomedical research fields. I think that we have to pay attention to making sure that young minds achieve funding at the NIH, and we position them to make those kind of breakthroughs. Now, here's the interesting statistic. When I was first involved with an NIH grant back in 1980, at the beginning of my career, the average age of the R01 grant, the median age for an R01 grant to be issued, that's the first basic NIH grant, was in the mid-30s. It's now in the mid-40s, with a straight line increase over the last 30 years. The bottom line is that we have to look and see whether at the NIH we are truly positioning this country to make the discoveries that will be the breakthrough discoveries. I'm convinced that the person who has the eureka moment to cure Alzheimer's disease is not going to be they're not my age, they're not 58. It's going to be someone in their 20s or 30s with a good basic background and training in biomedical research and in science, who puts it all together without the preconceived notions that honestly someone in their 50s and 60s have, and say, isn't this the approach you ought to take? So the first thing we have to do is we have to prioritize young investigators. We have to make sure that we return NIH emphasis to making sure that young investigators get funded. Second thing we have to do is we have to make sure that we have a direction for the NIH in the country, that we actually have strategic planning, that someone in the federal government, and preferably at the NIH, develops a plan that says these are the strategies, these are the places where we're going to emphasize the importance of biomedical research, and this is what we're going to do. Strangely enough, it doesn't exist at this time. So we need to empower the NIH director to go along that path. We need to make sure that the NIH actually develops a strategic plan for biomedical development in the country, and which diseases need our attention, what's the best way to find those cures. So we need to do that. Now, if we can do that, finally, what we need to do, once we get that, and we also need to reorient the NIH a little bit more, I think, toward basic research. The fact of the matter is that, commercial companies, obviously all these products will need to be commercialized, But commercial companies are just not going to spend money on basic science research. It wouldn't make sense. They wouldn't be treating their shareholders properly if that's what they were doing. But the country does have the ability to fund basic science research. It has the mode to do it, and it's the NIH. So we have to return to that as well. Finally, what we have to do is we have to realize that we have to get the basic science done. We have to develop translational methods, probably through public-private partnerships with industry that get the discoveries off the bench to the bedside. And then we have to make sure that that process is not hindered by the regulatory structure. And I think we're going to have a lot of discussion over the next few years about how the FDA, for instance, brings groundbreaking discoveries, whether it's the newest cancer drug, whether it's, fill in the blank, whatever the newest methods are, that are tremendous, that will save patients' lives, will save the healthcare industry dollars, how we make sure that that's delivered to the bedside. So we will have to look at the FDA and make sure that we develop a system from the very beginning right to the patient's bedside, that we develop the research system, we develop the translational system, and finally we develop the licensing system. So with that we can again, remain the biomedical research leaders in the world as we have been and as we should be. So with that, I thank you again for giving me a few minutes. I look forward to your questions.